and welcome to Focus on FCT, a program that keeps you up to speed with policies and programs of the FCT administration. I am your anchor, Mariam George Jitbo.
Residents of the Federal Capital Territory are hereby alerted to the activities of scavengers, also known as Babambula, which security agencies have identified as a high-level security threat to not only the residents but also to our infrastructure as they perpetrate petty stealing and acts of vandalism on public utilities. More so, they are drug peddlers, serve as spies to terrorist elements, and are ready-made tools for the public disturbances during which they attack people with dangerous weapons. The Federal Capital Territory Administration therefore reiterates that the ban on scavengers aka Bababula operating within the Federal Capital City is still in force. These miscreants are advised to stay off the streets of the Federal Capital City for their own good, as defaulters will be apprehended and prosecuted, including parents of underage children involved in these practices. Relevant agencies are carrying out enforcement of this ban as stipulated. Be law-abiding always. Let's together build the FCT of our dreams. Management announcer.
Saddled with the responsibility of coordinating the delivery of healthcare services, the FCT Hospitals Management Board also supervises the delivery of secondary healthcare services to FCT residents. Challenges and prospects for the board are issues put in perspective by the Director General, FCT Hospitals Management Board, Dr. Mohammed Kau, who is standing by with the details of the discussion. Don't go away. Do stay with us. Joining me now is the Director General, Hospitals Management Board, FCTA, in the person of Dr. Mohammed Kau. Glad to have you join us on Focus on FCT.
Thank you very much. You're welcome, and good evening. Good evening, viewers.
Let's begin by knowing the state of general hospitals in the FCT.
Thank you. This question is really interesting. I shouldn't be the one to assess the general hospitals in the FCT, but if you insist, I will say the general hospitals in the FCT, or we call them the secondary healthcare facilities, they are above average. If you compare our secondary facilities with what we see in other states of the Federation, I think, in all fairness, they are above average by all standards.
Would you say health workers in the FCT are living up to their responsibilities?
That one I can proudly say health workers in the FCT are living up to their responsibilities. This is because if you get to the hospitals, they are always jam-packed with people. And like any good restaurant, if you see people trooping into a place, that means they are getting services. And what we get from all the regulatory bodies, it means we are doing very well. By also having patients coming from neighboring states, like the contiguous states, Niger, Kogi, Nasarawa, Kaduna, a lot of them in the border communities, they access services in our hospitals. And so I can say our staff are doing very well, despite the challenges that are facing the country in terms of the recent increase in or what we call the petroleum issue, where cost of transport is very high. They are doing their best, and the permanent secretary and the management have done something wonderful by ensuring that transportation to the offices, either the hospitals, is revamped, and people are now being transported to.
And that brings to mind the recently signed off of the implementation of the standard operating procedures. How can this improve effective and efficient service delivery in FCT hospitals?
Thank you very much. I think this is one of the best things that can happen to FCT, that have happened to FCT. Ab initio, for the health sector, there is SOP for everything. For instance, in labor room, any pregnant woman admitted in labor room, there's an SOP that is followed by all the staff of the labor room, from admission to assessment to the procedures that are supposed to be carried out until the patient is delivered. There are SOPs. If you do this, if the patient comes in, you do this, you do this. If you find this, you do this. If you find this, you do this. If there's this issue, you call in this person. If this person finds this, you prepare and take the person to theater. See, until the patient is delivered and discharged. The same thing, if you go to the theater, for every procedure in terms of operation, there is SOP. You don't come and decide that I'm going to do it this way. No, it's standard. So for us in the health sector, government coming out to say every section or every part of the government must follow the standard operation procedure is just revamping what we are used to. If you get to Lebron Wusi Hospital now, you find at the wall tested standard operation procedure for normal delivery, for CS, for episiotomy, for all this. And the same thing if you go to pediatrics, if you go to every other ward. So I can tell you it's going to really, really help the workers. Even if you are just newly employed or you are just posted from another ward to that ward, you just follow the standard operation. You already have the background knowledge. You have your experience. But how you are supposed to follow and get your results is already outlined using the standard operation procedure. So it's a very good thing, and I'm sure it's going to improve the quality of care for our patients or FCT residents in the FCT.
Now, from General Manager to Director General, does this new nomenclature come with additional responsibilities?
Unfortunately, I have never been the general manager before I came on this desk. It has been changed to DG. Although this seat, before now, they used to call them general manager. But I don't think there is any difference. There is no difference in nomenclature. I think it's the responsibility. It's the same responsibility to oversee and manage the secondary healthcare facilities in the FCT. And there are 14 of them. So changing from GM to DG has not increased or decreased it. But I think the name DG is more befitting.
You now have this platform to share with us challenges and prospects for the board.
I can tell you, I prefer to talk about challenges. The prospects are there. Anybody that is serious, that is ready to work, the prospects are there. As people will always say, sky is always the limit of everybody. So that one is there. But there are a lot of challenges. The most important challenge we face in the health sector generally in this country is the staff attrition. Is health workers leaving the country in droves. There's a big challenge. No matter what you do, you have good buildings, plenty equipments, high-tech equipment. If you don't have the personnel, particularly the well-trained personnel, to use them, you're going to have challenge. And it's worst when you are not given time to plan. Somebody just decides to just obey the civil service rules. Those that even obey the civil service rules give you 1 month notice. Somebody just writes, a specialist writes and say, today, Friday, 10th July, I'm giving you 1 month notice. By 10th of August, I will leave. So how are you going to get somebody to replace that person? And unfortunately, it's not one person, 2 or 3 or 4 or 5. And it's not one cadre. It's not only doctors. Nurses are there living, pharmacists are there living, laboratories are there living, radiographers are living. So it's quite a big challenge. However, what FCT tries to do is, number one, to adopt a locum system where you quickly get somebody that's around that is willing to work as a locum. Locum means it's a temporary job by a health worker. Then you agree on the amount of money to be paid before you get somebody to replace that person. The second is that we collect the attrition list every 3 months and send it to the administration and say, okay, sir, we have lost this number of people, personnel, and they are so critical. So give us approval. So authorities always give approval. But you see, because you have to follow the federal character, you have to do all these things. It takes a bit longer time to get these people in. So these are the ways and means of mitigating this. So the second issue is the issue of congestion. As you may know, that the number of people trooping into Federal Capital Territory outnumber the plan. So every day people are coming in. Probably there was planned for 1.6 million for the FCT at this time. As of today, there are over 3 point something million people. These people, they need healthcare, they need education. For the healthcare, you enter a hospital, you find that by 10 o'clock, you enter the labor room or the GOPD, you find that you cannot pass. And so that is also a big challenge. The other challenge is, as people will always say, some of our staff also behave in a very unprofessional way, where you find some people try to exploit the situation. They are also giving us some challenges, but with the professional bodies, we are managing them. The other issue of normally finances. You don't always have enough resources that you would wish to have, but the administration is trying its best. By and large, these are the major challenges.
Okay, sir, you talked about health workers leaving the country for greener pastures out there. Is there no way that FCT administration will kind of entice them by bringing them back, by increasing their salary? Because I know it's all about salary, the salary structure. Is there no way we can do that?
I think, my sister, you should know that FCT administration does not increase salary. FCT is part of federal government, the National Wages Commission that determines the remuneration of health workers. But I can tell you, at the highest level, something is being done. I was in a meeting where Federal Minister of Health, all the CMDs of the federal institutions had meeting in UK, and these issues have been discussed thoroughly. A position paper has been sent to the minister, and the minister has sent it to the administration, the last administration. I believe this is one of the things this present administration is going to inherit. One of the plans is to engage one-on-one. It means if a doctor leaves, a doctor is replaced. If a nurse leaves, we don't have to go to Federal Character Commission, go and get approval, because they're essential services, they're emergency issues. So MDs of the hospital should be given authority to engage. If a nurse leaves, you get a nurse around and replace that person and write report to the authority, so that you don't wait until 10 people leave, 15 people leave, 20 people leave, and the service starts suffering before you start. So this is one of the something. In addition to what should be done for the health workers, but I can tell you, increasing salary does not always solve problems. By the time you increase salary, other economic factors affect it again. And I can also tell you that we have reasonable number of health workers that are out there looking for this job. I get a lot of applications. A lot of people come here physically looking for job, including specialists, doctors, nurses. So I think what government should do is to ensure that there's a smooth, easy way of replacing anybody who is going. The prospects are there. We have embarked on a lot of reforms with the last Secretary of Health. One of them is the drug revolving scheme of the FCT. where that will revolutionize the system and improve the services and the care. The other is putting all the 14 FCT hospitals in the budget of FCT, that they are captured and FCT funds them directly instead of using what the hospital generates. As you know, the hospitals are not revenue-generating institutions. They are social institutions. Before now, the hospitals generate some revenue and run themselves in terms of buying diesel, buying petrol, repairing the vehicles, day-to-day running. But now, government has put them in the budget. Government is sending this overhead monthly. That will definitely, or has even started improving the quality of care we are having. And the other is ensuring that all our hospitals are on EMR. Presently, out of the 14, 8 are on EMR, electronic medical record, where it's paperless. So the remaining 6 have also been captured.
Finally, your appeal to FCT residents.
I want to first of all thank FCT residents for the patience. They go to hospitals, they queue up, and they're very, very patient. And that is very, very commendable. I want to continue to appeal to them to continue until we all come together and sort out this issue of congestion and having to wait a little for your turn to get treated. And we assure them we're going to continue to give them the best. And with our Servicom, we have a lot of in all hospitals we have tested Servicom numbers, official numbers, that if they have issues, they should look for those numbers and call. My number is there. I can be called directly so that we are able to serve them better. They are our employers. We work for them. So we must give them the best we can. Thank you.
It's indeed a pleasure having you once again on Focus on FCT.
Thank you very much. I appreciate it also. Thank you, viewers.
Thank you.
The FCT administration has observed an increase in the influx of street beggars into the city and metropolis. When you give alms directly to street beggars, you encourage this unwholesome practice with its attendant risks to all. Remember, street begging remains banned in the FCT. Residents are encouraged to channel their alms through recognized channels as the churches, mosques, and orphanages. A better approach which still guarantees the reward of your kind gesture, as neither Islam nor Christianity encourages begging. This way, we can rid the city of this menace. To keep Abuja safe is our collective responsibility. Play your part. This message is from the FCT administration.
Well said there, as the planned implementation of the standing operating procedures, especially in the health sector, will no doubt enhance effective and efficient service delivery in FCT hospitals as obtainable in other climes. Up next is review of FCT activities for the past week.
Participants at the G7 Technical Committee meeting include security chiefs from the FCT and neighboring states of Benue, Kaduna, Kogi, Nasarawa, Niger, and Plateau states. They are here to brainstorm on best ways to addressing security challenges confronting the contiguous states. These stakeholders believe it is imperative as the G7 provides opportunity for intelligence gathering and sharing to confront the upsurge in criminal activities in member states.
The FCT has in the recent times witnessed an upsurge in criminal activities, ranging from kidnappings and kidnappers masquerading as scavengers, stabbing, carjacking, etc. And even more worrisome is the fact that this criminal element freely traverse the FCT and adjoining states. in perpetrating their criminal activities and then seek refuge in the neighboring states.
Chairman of the Committee and Commissioner of Police, FCT Haruna Garba, says the meeting will ensure the review of operational strategies of members to contain crimes and criminality in the FCT and her contiguous states.
The idea was for the state to put their resources together, both man and materials, to fight the criminals simultaneously. It's imperative that we acknowledge the gravity of the task at hand. Our dear states stand at a critical junction where security concerns have become increasingly complex and technologically based, which require coordinated effort from all the stakeholders.
Security experts believe this initiative will strengthen collective efforts in fighting cross-border crimes. Expressing his displeasure over the vandalism of the expensive gully inlets and manhole covers that were recently replaced by the FCTA, the Permanent Secretary Olushade Adeshola says the ugly act has led to the suboptimal performance of the drainage systems and consequent flooding on some city roads.
The manhole covers that were placed there, even on this particular road that we are, last year they were there, but now all of them had been removed. They were not removed by ghosts, they were removed by people. And this is Federal Capital City, where we have all the law enforcement agencies present. They want to beckon on every citizen and our law enforcement agencies to support the effort of FCT in protecting lives and properties through the provision of road infrastructure.
He, however, solicits the support of FCT residents to report any unusual or suspicious observations to the relevant security agencies for prompt action in order to forestall the ugly situation.
We have the number 112 where we can make emergency report when something unusual is happening. Report it so that our law enforcement agencies can be invited to deal with the situation. In this way, we will all be contributing to making FCT flood-free.
He advised members of the public who dumped refuse into flood drains to desist from doing so.
Let's now stand by for our sanitation watch for the week.
About 315 commercial motorcycles, popularly known as Okada, have been seized in a raid by officials of the FCT Directorate of Road Traffic Services. The tax team raided Buzape, Area 1, Apo, Galadimawa through Lugbe Expressway. Director of Road Traffic Services Abdulatif Bello, who was on ground to monitor the crushing of the seized motorcycles, says it is to rid the city of Okada riders who have in recent time been warned not to ply the city center. Hence, the regular clampdown of motorcycles aims at ridding the city of environmental and security concerns.
This exercise again is rolled out to prove to the recalcitrant motorcycle operators that we are not resting on our oars, and as long as they remain recalcitrant, we will not be tired, to roll out all our enforcement tools to make sure we put them under check. And it's a reminder to those who are still investing in this line of business that they have to think twice, because we will continue to remove them and crush them as long as they remain in the Federal Capital City.
Acting Secretary, Transport Secretariat, FCTA, Rahab Didam, who was also at the site of the crushing of the motorcycles, emphasized the commitment of the Secretariat in ridding the city of the nuisance by Okada riders.
It's like building on waterways, and then the structure needs to be demolished. This is what we're doing for all of us here, including the operators, to have a safe place to live it.
The Directorate of Road Traffic Services reiterated that the task force will not relent to sustain the exercise.
This is where we wrap up this week's episode of the program. Keep a date with us next week, same time, same station. Be vigilant and report suspicious activities around you. Goodbye.